Good morning, everybody. Thank you for joining us today. Just a reminder, a copy of today's slides is in the handout section of the webinar if you'd like to download those for today. Welcome to the second part of our ESG implementation webinar. My name is Rosie Falcone, Homeless Programs Manager, and today I'm joined by Timur Chattery, our Homeless Programs Specialist. Just a few housekeeping items before we begin. Please enter all questions in the questions panel of GoToWebinar. We can also unmute you if you'd like to ask a question at the end of the webinar by just raising your hand. We could do either. If there are any questions we cannot get to today, we will be emailing everybody a copy of the webinar once it's posted on our website, along with the questions and answers. If you have a question that is more agency specific, or you have a specific scenario you'd like to ask a question about, we do ask that you email those to our new general inbox, which is homelessprograms@tdhca.texas.gov. Please note that we no longer use the ESG@TDHCA inbox. Now all of our homeless programs funding will go through the one general inbox. And we will be posting a recording of this webinar on our ESG video library webpage. Today's session will focus on ESG program eligibility requirements, the type of agency level policies and procedures that should be in place prior to providing services, and client file documentation, performance and reporting, and the closing out of your contract. Next, Timur will get us started with the federal and state requirements that are applicable to performing ESG programs.
Thank you, Rosie. So subrecipients can use this slide as a reference for a non-exhaustive guide on the various federal, state, and contractual programmatic requirements that govern the ESG grant. For additional resources and lists of ESG regulations, please take a look at the Program Guidance for TDHCA Subrecipients page that's linked at the bottom of this slide. There are several forms and documents required at both the program level and at the client level. In your program level documentation, you should have the items listed on the slide as applicable to your program. We will not go into detail for most of these documents and forms in this webinar, so please be sure to reference the ESG documentation webinar that is located in our video library on our website. This webinar covers a majority of required documentation and forms, but note that not all required documents for running an ESG funded program are covered in the webinar. Of course, please also ensure that you reference your contract, the Code of Federal Regulations, CFR, and the Texas Administrative Code, TAC, to ensure proper compliance. Subrecipients of ESG funds must establish and uniformly apply written standards for providing assistance to ensure fairness among all program participants. Additionally, faith-based organizations are prohibited from using ESG funds for any activities that are explicitly religious, such as worship or religious instruction. It is also essential that all individuals served and activities funded are documented in HMIS or a comparable database, particularly for victim services providers, to maintain accountability and track outcomes effectively. For further information on regulations governing every subrecipient's written standards, please reference the stated CFR link that's linked at the top of this slide. Next, Rosie will review some of the processes for determining client and unit eligibility.
Thank you, Timur. The ESG program serves clients who are experiencing homelessness or are at risk of homelessness. People experiencing homelessness may be eligible for rapid rehousing, emergency shelter, and street outreach. People at risk of experiencing homelessness may be eligible under homeless prevention. Those who are being evaluated for homeless prevention eligibility must also have an annual income that is within 30% of the area median family income. The ESG program uses two definitions for eligibility across these program components: the homeless definition and the at-risk of homeless definition. Our video library has some webinars that cover each definition, its eligibility criteria, and its record-keeping requirements. We have also linked two handouts that detail the record-keeping requirements for each of the definitions from the HUD Exchange. As you navigate through the HUD Exchange, it is important to note that guidance provided there is meant for ESG recipients and not subrecipients. So please contact TDHCA if you have any question regarding program eligibility. We will ensure to have useful information linked on our webpage for you. Next, we'll go through a closer look at two definitions as they relate to homeless prevention and rapid rehousing participant eligibility. This table quickly reflects a summary of the categories under both the at-risk of homelessness definition and the homeless definition. Homelessness prevention eligibility includes all three at-risk of homeless definition categories, as well as categories 2, 3, and 4 of the homeless definition. For rapid rehousing, eligible participants must meet the requirements of the homeless definition category 1, which is literally homeless, or category 4, fleeing or attempting to flee domestic violence. While both components do have eligibility criteria under category 4 of the homeless definition, there are different restrictions for each component. Category 4 under rapid rehousing eligibility is restricted to those residing in an emergency shelter or living in another place described in category 1 of the homeless definition. For the homeless prevention component, eligibility includes having an annual income within 30% of the area median family income. It is important for new subrecipients or new staff to review the client eligibility and documentation requirements for the components they're awarded for. Next, we'll review the income requirements and timelines for recertification. In order for participants to receive benefits under homeless prevention and rapid rehousing, there are income requirements that must be met. For homeless prevention, the household's income must be at or below 30% AMFI at the initial client evaluation for eligibility. Households receiving services under homeless prevention must be reevaluated every 3 months. And as a reminder, your written standards must include procedures for evaluating and re-evaluating eligibility for ESG assistance. For rapid rehousing, income determination upon initial evaluation is not required. However, households receiving assistance under rapid rehousing require a re-evaluation at the 12-month mark. This re-evaluation requires that households have an income at or before or below 30% AMFI. Next, we'll cover client file documentation. Each of your participant files must include documentation that supports your eligibility and benefits determination. You must have an intake application, which captures demographic information of the household. The application is developed by each subrecipient. Participant files must have documentation which verifies the household meets either the homeless definition or the at-risk of homelessness definition. For households which are determined ineligible for ESG assistance, the file must include documentation for the reason of the determination. Each participant file must also include documentation of services and assistance provided, and as applicable, documentation that the proper process for termination of assistance was followed. For program participants who receives rapid rehousing for longer than 12 months, or homeless prevention, documentation of income determination must be kept. If proof of income is not obtainable, then the subrecipients can use the department's declaration of income statement, or if there is no income in the household, the certification of zero income. It is important to note that although the certification of zero income, income certification, and income screening tools are not required form, you must still have a system in place that adequately documents the income determination. After determining and documenting household eligibility, for participants receiving rental or emergency shelter assistance, the dwelling unit or shelter must also meet certain criteria. First, in order for participants to receive rental assistance, the dwelling unit must meet both rent reasonableness standards and it must not exceed the fair market rent. Participant files must also have a rental assistance agreement that must be made between the subrecipient and the landlord, which include the terms under which rental assistance will be provided, and include all protections that apply to tenants and applicants under 24 CFR Part 5, which is protection for victims of domestic violence, dating violence, sexual assault, or stalking. Each program participant receiving rental assistance must have a legally binding written lease for the rental unit that covers the period of assistance. Prior to receiving shelter or rental assistance, subrecipients must ensure that shelters receiving ESG funding comply with accessibility standards. In addition, shelters and dwelling units receiving ESG funds must meet the standards for safety, sanitation, and privacy standards as noted in 24 CFR 576403. A participant receiving rental assistance must also include a request for unit approval, which the subrecipient can create on their own. This form serves as a request by the tenant or the subrecipient to calculate utility allowance and inspect the rental unit for occupancy. Prior to providing rental assistance, subrecipients must inspect the dwelling unit in order to certify the unit meets the minimum habitability standards under Section 576.403C. An inspection must be conducted at least once every 12 months during the period of assistance in order to confirm the housing continues to meet the minimum housing standards. For those units built prior to 1978, subrecipients must provide the program participant with a Protect Your Family from Lead in Your Home pamphlet, which is available in many languages. It is important that this document be provided in the language the head of household can understand. The lead screening worksheet can be used to document adherence with lead verification requirements. Next, the Violence Against Women's Act is a federal law that in part provides housing protections for people applying for or living in units subsidized by the federal government who have experienced domestic violence, dating violence, sexual assault, or stalking to help keep them safe and reduce their likelihood of experiencing homelessness. It is important to emphasize that anyone can be a victim of domestic violence, dating violence, sexual assault, or stalking, not only women. Any information submitted to an ESG subrecipient in response to a VAWA requirement or provision, including the fact that an individual is a victim of domestic violence, dating violence, sexual assault, or stalking, is confidential information. Therefore, subrecipients cannot enter this confidential information into any shared databases, including but not limited to the Homeless Management Information System, or HMIS. This is why subrecipients that are victim service providers, or VSPs, as defined by HUD, must use a comparable database to HMIS. Although not Every subrecipient qualifies as a victim service provider. Any subrecipient can provide services to households or persons that are seeking protections under VAWA. For easy reference, we've included some resources to the right of the slide. At the bottom, there's a quick guide of when to use a comparable database. As ESG subrecipients providing rental assistance, either through the homeless prevention or rapid rehousing components, you must provide applicants with certain notices. Every person who applies for or receives assistance must be informed of their full rights under VAWA to ensure they have the knowledge required to exercise them. Along with the notice of occupancy rights, every participant receiving rental assistance must also receive the certification of domestic violence, dating violence, sexual assault, or stalking. This form is required to be provided to the participant, but it is not required to be completed. It must be completed if the participant is seeking protections under the VAWA Act. Subrecipients may document the provision of these required forms by completing the VAWA notification certification. And we have a sample form on our TDHCA website. However, subrecipients may create their own.
Thank you, Rosie. So next, we will take a closer look at the housing contract system and the monthly performance report. So the housing contract system is divided into two levels, the contract level and the activity level. The contract level has documents that are pertinent to the administration of the contract, such as the executed contract, any amendments that have come through the subrecipients' written standards, the HCS access request form, the direct deposit authorization form, etc. The activity level includes all monthly reporting, which includes the monthly performance report, the monthly expenditure report, and all total draw requests. So with the acceptance of ESG funds, you agree to enter data into HMIS or a comparable database for those operating as domestic violence or legal service providers. This data is then used to assist providers with filling out monthly reporting to TDHCA. As a reminder, subrecipients must submit monthly draws that consist of both the monthly performance report and the monthly expenditure report. These draws will be submitted through the contract system no later than the last day of each month and reflects performance and expenditures conducted in the prior month. So I want to go over for the next few slides the monthly performance report. So here you'll see an abbreviated version, but there are 4 unique sections of the monthly performance report, and we'll go through each. The first is the totals. This is where you report the total number of ESG program components entered into by clients or client households during the reporting month, inclusive of those that were served with ESG match funds. Clients who enter multiple components within the reporting month may be reported as more than one entry in this reporting category. Next, under unduplicated ESG entries, you'd report the unduplicated number of clients who began receiving ESG assistance during the reporting month, regardless of what component they entered. If a program participant or client household entered multiple components during the month, they'd only be reported once here. An error that we commonly see on performance reports is when the unduplicated ESG entry values are greater than the total component values. Next, I want to go over demographics. It's a pretty self-explanatory table, but every column in this section should reflect only the data from the unduplicated program participants who entered the program during that reporting month. As a reminder, staff observations should not be used to collect any data. Third, the special populations table. So the special populations subcategories should represent the individuals served, rather than the number of services provided each person. Individuals may be counted in multiple special populations if they meet the criteria for more than one category, and all values in this section should reflect the unduplicated individuals at the time of project entry. Some common deficiencies that we see in this section is the overarching special populations box not being completed, but values existing in the subcategories. Another is when parenting youth are reported, but their children are not reported, and vice versa. If one is completed, the other must be completed as well. Moving on to the component sections, I'll be using the homelessness prevention section as an example, but the NPR has sections for each of the 4 program components. Also, please note that you should only complete the sections that you are funded or providing match for. The sum of all component person and households must equal the total persons entering for that month. Please note that if the performance for a component is reported in the NPR, then the corresponding expenditure should also be reported in the monthly expenditure report. Lastly, if a request for an emergency transfer is received during the reporting month, please ensure that you provide the number of persons that have requested it. Now we're going to go on to submitting. So once a performance report is complete, you'll click the submit button at the bottom of the page. If at any time you'd like to save your progress and not submit, you can click the save button. While you can save as many times as needed, you can only submit the performance report once. Once submitted, all the data fields become locked and only TDHCA staff can edit it. For further information on the performance report and the specifics on what every data field means, please reference our monthly reporting guide, which is linked on this slide. For 2024 subrecipients with an active 2023 contract, it is important to know that for performance report, program participants that are assisted continuously as the contract ends and the new contract begins in the same program will count as new program participants for the contract, for the 2024 contract. Please report each program participant only once per contract. However, the start of a new contract does not require new eligibility determination or documentation for program participants, except as required by federal rules for ESG. I know that a few of our subrecipients have an extended 2023 contract. Please prioritize spending those funds first. Also, for subrecipients that have current contracts, there is one measure on reporting that is for maintaining housing for 3+ months. Program participants that are served with rapid rehousing or homelessness prevention funds who exit within the last 3 months of a 2023 contract are not able to be reported in terms of maintaining housing for 3+ months in the 2024 contract. They may be reported as maintaining housing for 3+ months in the 2023 annual contract with the appropriate follow-up. So there are several useful resources for when you're collecting and reporting data. At the federal level, HUD has issued guidance on HMIS and data in the HMIS data standards and in the ESG program HMIS manual. Resources from the department can be found on the ESG guidance webpage that was linked earlier, and the monthly reporting guide and sample monthly report as well. As a reminder, the monthly reporting guide goes over HCS access, report submission, and the specifics of what is needed in the reports, included what exactly is to be reported for each of the data fields in the NPR. Lastly, in this section, we will take a look at the closeout process for those of y'all with current ESG contracts. So since most of our subrecipients are returning, it is important to note a few dates related to your ESG contract closeout process. First, any budget or contract amendments must be submitted 30 days before the contract end date. Secondly, all reporting must be submitted within 30 days of the end of the contract period. Please note there is no cumulative report. Please just submit your final report and mark the final draw box on the MER. It is important to remember that for those of our subrecipients with a contract end date of October 31st, 2024, any performance and expenditures that is not submitted by the end of this month, November 30th, may not be eligible for reimbursement and consideration in your performance outcomes, which may impact your next ESG application score for the upcoming 2025 cycle. For each contract that your organization has with the department, an inventory report must be submitted within the closeout period of each contract. The inventory report must include any item with a useful life of a year or more, or has a per unit value of $5,000 or more. The inventory report must be turned in annually until the equipment is either sold or it has reached its useful life, or its value is under $5,000. Please ensure that proper disposition guidelines are followed. The inventory form is located on our website and it is linked on this slide.
Thank you, Tamor. And thank you everybody for your participation in today's short and final webinar, and for all of the work that you do to help our most vulnerable. This does wrap up the second and final part of the 2024 ESG implementation webinar, but we do open up the floor now for any questions. If anybody does have any additional questions about reporting, anything we covered today, or something that we failed to cover, but you have questions on. And we did receive a few questions earlier. One was if the unit inspection and the lead-based paint applies to both rapid rehousing and homeless prevention. It does apply. It applies anytime you will be providing rental assistance. If you're going to be providing rental assistance, these forms do need to get provided to the applicant. The extent of what forms and how many does depend on the dwelling unit. So if the dwelling unit was built before 1978, you will need to make sure you give all of the required pamphlets. If you are unsure when the unit or when the dwelling unit was built, we do have the screening worksheet. Tamor, if you could go to that slide for the Let's Save. So the lead screening worksheet, what that is if you are unsure or if you want to make sure to use that to document that you are following lead safe practices, that worksheet will take you through several questions that you answer in order to determine if you should be giving the participants the Protect Your Family from Lead in Your Home pamphlet and the lead-based paint hazards disclosure. Just a reminder though, we don't do any testing. ESG program does not require you to have any, let's say, renovators. So you do not need to do any actual testing. Your go-to date is 1978. We also do not allow with ESG funding any construction or rehab, so we shouldn't be disturbing anything that might cause lead, if there's lead present in the home, to come out in the particles in the air. So you just need to ensure that you're giving the 2 required pamphlets if a unit is before pre-1978 for rental assistance. If you're unsure and you want to make sure you're documenting all your steps that you verified for this, you can complete the lead screening worksheet and put it in the client file. Another question we did get earlier was if the TDHCA NPR report will be updated in HMIS, or if we would be using other reports like the ESG CAPER to fill in the TDHCA Housing Contract System report. These are separate reports. So the Housing Contract System you will be using on a monthly basis to report your performance to the state and also to claim your reimbursement. So those two go hand in hand, and those are the ones you submit to us. The HMIS data is the data that we are going to request from you once a year. So around early September every year, we're going to send your contract contact a link, or from Sage. Sage is going to automatically send that link with every component that you were funded for. And then we need the CSV files from HMIS for the last 12 months. And it doesn't go by program year, it goes by HUD's fiscal year. So we'll let you know what the term of it is. Sometimes it crosses contracts, and that's okay. But those two require different data reporting, and therefore 2 different uses. So one, HMIS feeds into Sage once we send you those links once a year. and the housing contract system and the MER and the NPR are how we reimburse you for the grant, and then how we obtain data from what has been happening, whether through direct ESG funding or through match activities. The other question that we did receive last year, the HMIS standards did change. This unfortunately created a difference in what data we collect between the housing contract system and HMIS. So this did add an additional burden to you all in terms of collecting data. There are two sections in our reporting system. One of them is ethnicities. That does differ of what we are, race and ethnicity of what we're collecting. We aren't able to update our contract system because we use that system to do statewide reporting. So we do still need to collect on those two data points. So as you go through your systems of record, reach out to us if you have a question on what it is, the steps that you need to do, because we do need those two sets of data, the ones that the new HMIS standards put in place and the ones that we have been using in the past in the housing contract system. To more on the monthly performance slides, he did link our guide. We are in the process of updating. It should be updated within the next 2 weeks, but we'll send a listserv as well, and it will speak to the differences of the reporting. Another question we received is, where do we retrieve the AMFI standards? We link those every year on our webpage. We do get them from HUD. We don't use the very low income standards, so it's very important that when you are using and when you are checking against the 30% AMFI for the ESG program, you are using the link that we provide on our website. We update it as soon as those requirements are placed in there. We can send out as well that link to more. I don't think we have that in our slides, do we?
We do not, but I can send it after the webinar to everyone who registered.
Okay, do you want to take the next question and then I can drop the link in the chat?
Yes.
Thank you so much.
So we have a question from Leanne. So for the contracts, for the upcoming contracts that began at the beginning of November, so these contracts are going to be entered into DocuSign this week. We did have a few delays. Our legal team needed to take a look at a few things, but rest assured that if you haven't gotten these contracts yet, you should be getting them in the next few days.
Okay, I just added the link to the chat. That is straight from our website. You can also find it on the HUD Exchange. The reason we didn't link that is because the HUD Exchange, you have to go to other sections to find the actual 30% AMFI for ESG. It immediately takes you to what the home program uses. And so what we do is we take that spreadsheet that you would have to find on the HUD Exchange and we link it and update it on our ESG subrecipients webpage. When you click on it, it will, depending on your settings, it will either ask you to save it because it is a spreadsheet where you can go through the counties. And that's what that will open up that you can use. Another question we received was do we still need to complete the lead-based paint disclosure if the unit was constructed after 1978? No, you do not. If the unit was constructed after 1978 and there is no suspicion of lead present, then you don't have to do that. The reason for the 1978 is because that is the federal regulation and what OSHA uses. Because it is very likely that the paint or other items in there do contain lead. If disturbed, it could cause an issue. Maribel, your question, I don't know. So it says there was an active report in HMIS, the supplemental ESG monthly report, that reflected the same information requested in the HCS, but it's not available anymore. Are you planning to ask HMIS staff to reactivate it again? Yes, we can definitely reach out. We are planning in the next couple of weeks. We just want to make sure all your contracts are activated. Any access or questions you might have for your new contract are settled before we do reach out to the HMIS leads to see who would be available to meet with us to go through other things, and we'll add this to the agenda. Another question we received is when it comes to reporting, maintaining housing for 3 or more months for clients that exited within the last 3 months of the 2023 contract, what is considered appropriate follow-up as mentioned on slide 22 so we can report it on the 2024 contract? Tamar, can you go to slide 22? Okay, so in order to be able to successfully report somebody maintaining housing for 3 or more months, so we are talking about somebody that could be on the 3rd month is your October month, which is the end of your 2023 contract. Before you can report that, you have to have in the client file your meeting, a meeting with them, a phone call with them, something to document that you are in touch with them. They have been stable in housing for at least the 3 months. Then you would be able to report it successfully in your 2024 contract. The file would be the same. The important thing here would be following your procedures of what your contact with them means. So if in your written standards and your procedures, you have your monthly meeting, it has to be a meeting, you go through and you complete certain forms or you complete certain processes, that would be the same, it would still apply. The time frame is what we're looking at. So you wouldn't be able to report it in your closeout for the 2023, but you would be able to report it on your 1st month in the 2024, and your backup would be you following that process of documenting you have met with them. The key is that you have either spoken with them, met with them. And then the next question, unfortunately, we will not be able to address. We do not have access to HMIS. HMIS is only subrecipients that have direct contact with participants get access and use HMIS. So the question is, what report in HMIS do you need us to run as backup for the monthly MPR and HCS? I would not be able to tell you if there is a report or not that you could have on there. We can ask some of the HMIS leads to give us some samples. We just don't have access to that system. However, what we could normally use as the backup. So if you can monitor, you don't have to submit anything to us on a monthly basis. What you do is you complete the fields that Tamor showed you on the screen directly onto our system, and you don't have to upload or attach anything. The only time you do have to attach something is if you are making a change or requesting a change. And the reason for that is that we are the only ones allowed to change something once you've submitted it. So we need that support documentation that shows why we're making that change. Typically, compliance would ask you for a cumulative report or a monthly report, and all they would need to see is an identifier, so some way to identify a client to a file, and the types of services that they received. Once they have that, what they will actually be checking against would be within the actual client file. Thank you for that catch. So we do have a clarification for this slide. The first bullet should both be 2023. So it says program participants served with rapid rehousing or homeless prevention who exit within the last 3 months of a 2023 contract are not able to be reported in terms of maintaining housing for 3 or more months in the 2024 contract. So that last section should be updated to read 2023 contract. We'll make sure to update the slides when we post them on the website. Okay, it looks like the questions have slowed a bit. We will stick around for another 10 minutes or so to see if we get any other questions. There is a regulation we did not include in our slides. It is part of your contract. We did not include it because for the most part, what you will be performing, it does not trigger the Buy American, Build American clause. But just as a reminder, if you're solely providing shelter services or rental assistance, essential services, things like that, the Buy American, Build American does not apply to you all, but I did want to bring it up in case there is some of your other either CSC funding, or if you get ESG funding through another pass-through entity, they do bring that up. Since construction and rehab is not an eligible use of TDHCA pass-through ESG funds, it does, it would not trigger any of your activities, would not trigger the BABA Act or Buy American, Build American. Okay, well, we do want to thank you for your time and staying with us throughout the webinar. If you do think of another question or something else comes up, please feel free to send us an email. We will be posting the recording along with the question and answers on our website. We will contact our HMIS leads prior to posting it so that we can get as many questions answered as we can. But if for any reason we can't get through all of the HMIS related questions, we will still post it so that way staff has quick access to it, and then we will just update the question and answer when we do get those answers.